Everybody, I'm Mark Hassert, the Secretary General of the European Association of Hospital Managers, EHM. I welcome you to our EHM session during the World Hospital Congress in Barcelona, organized by the International Hospital Federation. If I look back, 2020 and 2021 were very difficult times for us, for the hospitals, for the hospital managers, but also for the hospital associations and the Hospital Managers Association, because a lot of events were cancelled. But it was also an opportunity for us because we could reflect about our kind of working and how we can improve our work. And one important things we did in 2021 was in March 21 to sign a very important cooperation agreement with the International Hospital Federation. So we have the possibility to share events and to work together on specific topics. And this is also the way we could participate today as in the program of the IHF Congress in Barcelona with our session dedicated to the visions and the role of the hospital managers in a post-COVID world. So we have, it's a pleasure for us to be here in Barcelona and participating in this session and organizing this session. And I hope we will also have the opportunity to invite the IHF to our events, to participate in the program of our events. And especially one event I want to mention today, it's the 29th Congress of our association in the 2nd and to the 4th of March 2022 in Hungary, in Budapest. You can find flyers about this very important event here behind. And at the end of the session, we will show you a short movie to promote our Congress in Budapest. And I hope we will see a lot of you in Budapest next year, and we will have a very good attendance. But first, we have to start today with our EHM session during the IHF Congress in Barcelona. So I give the floor to our chair, Lucy Nugent. Please, Lucy.
Thank you, Mark, and good afternoon to everybody. I'm delighted to be able to chair this session with you. The session basically will be featuring two panels, one focusing on human resources and one on mental health. There will be a question and answer session after each of the panels and an overall questions and answer session at the end of the two panels. For those of you joining us virtually, you can send your questions in by clicking on the question and answer tab on the right of the screen. For those of you who are here in person, you can send your questions by first downloading the Congress app, clicking on the Q&A from the home screen, and please make sure you select the right day and session. We are Wednesday, 1510, room 6. There'll also be a microphone available as well. And to get to know the presenters more, you can look at their profiles on the Congress app. So it gives me great pleasure to introduce Daniel Greca, our first speaker, who's joining us virtually from Brazil. Daniel is the Population Health Management Director of Hospital Sierra Leban and Fellow of the Brazilian College of Healthcare Executives. And again, just to remind you, you can put your questions up on the app. Thank you very much.
Hello everyone, my name is Daniel Greca and I'm here today to share a little bit of the findings there, our recent research that we did in Brazil about healthcare leaders and leadership, what this study can show us and even provoke us in some ways. And of course, the main goal of this study was to answer some of the questions that we ask ourselves and questions that sometimes we don't have a clear answer. For example, How does our healthcare leaders look like? Even when you think about how they see themselves, how do you see yourself as a leader? Or even what are the challenges that they face now and they think they will face in the future. So the study was based on interviewing people to understand and try to answer those questions. I'm going to share with you guys here today a bit of the findings so we can think and maybe have some insights and think if all of these also apply in your country, in our home country. The research was led by the Brazilian School of Healthcare Executives, which I'm a fellow. I am also a director for a population health management unit for a hospital here in Brazil. And the research had a lot of sponsors and one advisory firm that helped us, which is showing here, KPMG. And I'm gonna, before we share the findings, we're gonna tell a little bit how we did the research so you can understand about the method. So we divided in 3 phases. The first one was the census, pure and simple, the census. The second one, we tried to understand the profile of the healthcare leaders. And the third one, the challenges, leadership in terms of the sector. We interviewed more than 1,500 healthcare leaders. So all of them, they are leaders somehow in their own organizations. Of course, we tried to cover different players and different genders and different ages. So we have a very good and a very good representation. Brazil is a huge country. We all know that the GDP is very concentrated in the southeast, as you but we try to cover the whole country. This is the first edition. When I do this, an annual thing. So when I do this year, the next year, and the year after, I want to put this together, start seeing a movie and how we are progressing in terms of healthcare of workforce or even leadership. So the first one, we have more representation in the southeast. But as time goes by, the next edition, we try to spread even more and have more representation in different. All the healthcare value chain participated. So we have providers, we have payers, we have even professional services firms, pharma industry, medical device industry, startups. So we try to cover it all. So in terms of the findings now, let me share what called my attention. And this is a good sign, the first one I want to share. And of course, you can think if it's the same happens in your home country. 80% said that there is a initiative in terms of gender equity. So this is quite important. We all know that diversity and inclusion is a hot topic nowadays. A lot of organizations are trying to think on how to put that in practice. In terms not only board, but also leadership and in all different levels. And when I saw the result that 80% said that there is gender equity initiatives in their own organizations, I found that really, really interesting. And I was quite happy to see that and how important that is and how it can trigger even productivity when you have equity in terms of gender in your organization. So that's a good sign. That's a good result that we found. Another one that called my attention is when we ask leaders about the gaps that they see in leadership, not in themselves, but in leadership in general, those 3 things were mentioned. So the first one is communication and relationship. And that's key for a leader. If you can't build relationship, if you can't keep a good relationship, not only to peers, but also the people that report direct to you, even in your leadership, now that's hard to put leadership in practice. And that's a gap that they see that leadership in general, at least here in Brazil, has. The second one is understanding the health system. That's concerning too. How can you think strategically if you don't understand the system as a whole? If you don't understand the public, the private, and the players that form the health value chain, if you don't have a clear vision about how the system works, it'll be hard for you as a leader to take strategic decisions and to think strategically. And the third one, and there's no surprise here, is digital health. We all know that digital health is a big thing happening all over the world, different healthcare systems all over the globe. And we all know that it's hard to put that in practice in a good way. To make it digital things that really matter and do it in a proper way with a proper roadmap where you have technology not as an end, but as something that will help you get there. So digital health is something that the leaders said that it's concerning to them in terms of gaps of leaders. This is what really caught my attention. And for me, in everything that I saw in the results, this is, I think, the most concerning one. When you ask the leaders about themselves, how do you see yourself in those competencies that I put it down here, like leadership, for example, which is the first one, that's concerning because when you ask them about how they see themselves, let's take leadership, for example, and all the results are concerning except for digital health. They see themselves that they're really good. For example, let's take leadership. Almost 80% of the leaders that participate in the research, they said that in terms of leadership, they either fully achieve or overachieve. 80%. I don't have the feeling that that's true. It sounds to me that it's like when you ask people, and I can ask this audience here, if you think you are a good driver, probably 80% of the people raise their hand and say, I think I'm a good driver. And stats show otherwise. Stats show that 50% of the people are bad drivers. So it sounds to me, it looks to me that it's something like that. I don't think leaders today, and that's something that it's my opinion, have a clear vision about themselves. Of course, it's easier to think about other leaders except for yourself. When you think about yourself, there's a trend here that you don't see properly yourself, especially your weaknesses. Leadership, communication, social and professional responsibility, health system as a whole, and business commitment. Digital health, I understand. That's a different stat, and people think they're struggling in that sense. But the other ones, I think we are probably overestimating ourselves in terms of leaders, and that's something we should think about, us, of course, as leaders. Keep sharing the findings here. We also asked the 1,500 people the most valuable the most valuable competence they see in leadership. They see in their leadership, and leadership was the answer. Of course, leadership is a very broad word, but when you try to think about the concept, we're talking here about how you can take action, how you can take decisions, think strategically, how you can manage people. That's important ones. How you can keep good relationships not only with peers but also with the industry and the sector. So how you inspire people. So it's the most valuable competence that the 1,500 people, most of them actually. When asked about the challenges, and those are the 10 topics that they answered when they asked about how to see the challenge from now on. And digital transformation was the first one. I'm not surprised. Digital transformation is also a hot topic. The whole sector is trying to do it properly. We all know it's hard. There's a lot of legacy that sometimes it doesn't help you get there. And digital transformation is something that clearly the studies show that it's the most concerning topic for most of the people that participate in the research. The second one is the healthcare system weaknesses and how sometimes it doesn't allow you to do your business or even to deliver value. The third one was mental health, and mental health not only for patients, but also for the workforce. We all know that's an issue for healthcare professionals when we talk about mental. Financial and business and financial management was the fourth one. Healthcare costs, and I'm sure Brazil is not the only country in the world that is trying to control healthcare costs. And I'm also sure that Brazil is not the only country that has double-digit growth in terms of increase in healthcare costs. Of course, that's very concerning. The sixth one was workforce, and I also know this is a global thing. It's about quantity, it's about quality. And for a huge country as Brazil, it's also about distribution. We don't have well-distributed doctors and healthcare professionals all over the country. Change management, of course, if you are transforming in terms of digital, of course, it makes you work in change management. That's really, really hard, and especially healthcare. It's a hard sector to transform. Strategic planning, innovation, which is all connected to digital transformation. And the 10th one was to understand healthcare as value and not just healthcare as it is today. So those are the top 10 challenges that leaders answered and how they see the future from now on. The last finding I would like to share, and that's my last slide, I'm sorry, that's good, is we asked them how they see the pandemic. And if the pandemic has accelerated digital transformation, and 74% agree that the pandemic has accelerated digital transformation. I don't see this as a surprise. Actually, we all know that. Of course, digital was in our agenda, was a hot topic before the pandemic, but we all know, and that's quite obvious, that the pandemic accelerated digital transformation. And in Brazil wasn't different. So this is my contribution for now. Of course, I hope this brings some insights, not only to you in the audience, but also to the table here we're going to discuss. Thank you again for the invitation. It's very nice to contribute somehow, and I hope you guys enjoyed it. Thank you.
Thank you very much, Daniel. That was very enlightening. I have questions certainly to ask you later on that. Our next speaker is Philippe Blua. Philippe is the CEO at Champagne-Sud Hospital in France. And he's also the president of the European Association of Hospital Managers. And again, we can take some questions and answers after Philippe's talk. The floor is yours.
Thank you, Lucy, and hello, everybody. Yes, I will try to it will be better with that mask. And I will try to speak with you about crisis management and to say to you, if you work in hospital, crisis will be your life, but it will be also opportunity. Just, oh, I have a problem to move. Oh yes, it's all right. So I moved too much. So just a little word about my background. I work in hospital since around 30 years, 2 years in the French School of Hospital Manager, then 10 years as director, and since 20 years as a CEO, actually in Champagne, you know, where we make the good wine to comfort you when you are in trouble and to celebrate victory. And in a group of 8 hospitals. So I have also background in associative association around hospital, actually as president of IHM, and as Mark tell you, if you don't know what you have to do on the beginning of March, you can go in Budapest. It was a wonderful place with a wonderful congress, I'm sure. And before to go in Troyes or to see on the web, we have a congress about e-health. Our association, we are in 19 countries actually in Europe. Well, first speak about the main lessons of crisis in my mind. First, you have to know that life is just a succession of crises. We must be prepared and prepare your staff to manage that. Second, preparing for a specific crisis for me is a nonsense, because if you know what crisis happened, it will not be a crisis. 3, be ready, act quickly. The sooner you will detect and react, the better it will be. 4, crisis management must be collective. And 5, crisis is not only a trouble, it's also an opportunity. When I prepare my speech, I try to remember how much big crisis I lived during my professional life. Only big crisis. Small crisis is near every week. Yeah, it's a hospital. But big crisis, I said, oh, so much, 25. And at the same time, my country lives almost 30 crises, big crisis. So each year you have a crisis, a big crisis to manage. And so crisis is life. Also, crisis is always unexpected, because if you could foresee the crisis, you will react before. And so damage will be not so important. And the worst crisis occur always when you don't have any alert, or when the time is too short between the alert and the beginning of the trouble, or when you don't take care, and it's open, it happens very often, when you don't take care about the alert you have. Sorry. Just an example in France. In 2003, our government asked us to be prepared when we are working in Paris to have too much water, because at the beginning of the 20th century, there was a very big flood and half of Paris was underwater. But what happens? All people are working about that. But what happens? Not too much water, too much sun, the heat wave with a lot of dead people. Why the flood don't happen? Because the government do the job. He know this crisis could happen, and he prepares that. He create 4 reservoir lakes, and he manage the flood. And for the moment, still no flood. But no, we are prepared to have heat wave, and we have in the past 3-4 more heat wave, but no more died people, because we are ready to manage that. So if you are prepared to manage the crisis, it will not be a crisis, only business as usual. Second point, how to protect our hospital from crisis. First point, I just speak about that, is of course to manage the security, to spot the danger, and to try to work to reduce them. But one important thing is to build a good warning system. And one thing very, very important when you are CEO, never fire people that come in your office with a bad news, because nobody like to go to see his boss to say, I have a bad news. So if you begin to find people that do that, they will put bad news under the table, and you will have problem because you have no alert. When you go in somebody of my staff come in my office and said, I have a bad news, I began to make a big smile and say, okay, we'll manage that together, but never fire people. Second point is, it's very difficult to know the crisis that will happen, but you can prepare a crisis management. It's not exactly the same thing. How to react together if we have a crisis. On any subject is not the problem of the subject, but the organization is a good way to prepare a crisis. So it's important to analyze past crises and to learn more from the organization than the crisis itself. And one thing important actually is also to think about crisis communication, because sometimes the difference between a small problem and a big crisis is good or bad communication. Other point, it's very important to react quickly and strongly, and it's better to overdo than to do nothing. You know, in France we said, ridiculous never kill. And it's better to do too much things than to do nothing, because it will be a training. It's not a problem. Perhaps people love of you, but it will be all. If you don't react, it could be a very big problem. What happens about H1N1 in France? H1N1, sorry. At this time, our health minister bought 2 million of masks, and she was very criticized in media because nobody used it, because it was not a very big crisis. But she still remained minister, and now everybody said, oh, she do well, and she's still minister. She's an alive politician. In 2020, the health minister do nothing. She was afraid to be criticized by the media. But now she's no more minister, and she's in front of the judge for his mismanagement of the crisis. So, ridiculous never kill. To prepare a crisis, I think it's very important to, when there is a threat of somebody will happen, to create a watch group and to take almost some minimal precaution. For example, in my hospital, in January, before the COVID go out of China, we remember what happens with the flu and we bought a lot of masks, and we need it. It will be very useful because at never moment during the crisis we have problem with individual protection. We have ever individual protection for everybody. And after, in February, we prepare a work group to look how to have as much information as possible about crisis and to prepare the management of the COVID. Other lessons, crisis management must be collective, and I think it's very, very, very important. Collective, of course, inside the hospital, because nobody has a view, a 360-degree view. You know, your view is 120 degrees, and the good view is 60 degrees. So to have a 360-degree view, you need to be almost 3, and the better is to be 6. So you need to be together with people with different point of view. Also, if you may have a collective management, you create consensus, and it's better to apply decision. You create solidarity, and also it's a good thing for the future, because when you win together in team, you create strong team. Ask to military people, and also you protect actors. If there is contestation about what you do, it's very difficult to challenge a decision taken unanimously by medical staff, chief doctors, chief manager, and chief nurses. It's a very important point. So during our crisis, the last crisis, COVID, we create 7 working groups to analyze problem in on different topics, and there was a strategic group that are here to coordinate the works of the different group. And of course, in the strategic group, there was a president of each working group, and also chief nurse, chief doctor, and hospital manager of the 8 hospital of the group. And after, there is local group in each hospital to apply the decision, because our hospitals are very different in size and specialty. So we need to apply differently the decision. And also, when it's a big crisis like COVID, it's important to manage the crisis also with other institutions. For example, of course, with other health institutions, because you can need to have their help to manage patients, but also with other institutions. For example, we need town administration to give us big local space to make vaccination, and so we need to coordinate together to do that. We also use army to control the queue for vaccination, because it's easy to say no to somebody, a woman in white, but when you are in front of a man in Rangers, you say yes. But last point, and I think it's a good thing of the crisis. Crisis can be a solution to, as Daniel say, to accelerate changement. I speak about event crisis like epidemics. It's really a good thing, because you know, Jean Monnet is one of the fathers of Europe, and he said men only accept change in necessity, and they see necessity only in crisis. That's a very important sentence. During an health crisis, hospital workers will accept change because they discover the heart of their profession. They save life. And they will say, oh, okay, yes, no problem for a decision during the crisis, and the same decision before the crisis, they will say, no, it's not possible because blah, 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 it changed. People don't like to change. But when there is crisis, people accept to change. So for hospital, crisis are problem. For all institutions, crises are problem, but are also opportunity to develop what was underway before. And for example, in my hospital, we developed during the crisis teleworking and telemedicine. We developed mutual aid between our hospital. We are a very young group. We work more than usual with local authorities. We work more than usual with other health actors, and also we become the hub of the care in all our country, our land, and the support of the smaller institution. It was soon under the way, but it accelerates the changement. Well, thank you for your attention, and yes, if you want more information about our organization, you can.
Thank you very much, Philippe. And I hope Daniel is going to join us up on the screen again. Is Daniel with us? I'll go first to Philippe then. Philippe, you said that life is a series of successive crises. If that's the case, COVID surely is different, because normally we would have, a major incident. It might last a day, 2 days, 3 days, and we recover. And staff can recover and re-energize. The pandemic is going on now for more than 20 months. Has your organization had the chance to pause, stop, reflect on what's worked so far in the pandemic and what hasn't? Have you debriefed? And how do you also maintain that esprit de corps that you get in that initial crisis period?
Yes, that's you are right. That's the difference. And during COVID crisis, because we know it will be a very long crisis, we managed to put as much people as we can in holidays to allow them to rest. We do that before the crisis, when at the beginning of the lockdown, when we see the waves that coming from the east of France to us, we put a lot of people in holidays, and after during the crisis, between two waves, we try to give time to people to recover. And also we use sometimes some champagne.
His hospital produces their own champagne. I want to go and work there. Are there any questions?
It's one time in after a strategic committee, man of the president of the supply chain give us a breakfast, and everybody with beer and not only champagne. And people are very happy, and still now people speak about that.
Okay, so sometimes having an event like that to thank staff and acknowledge them, you reap the rewards of that.
To have good time together, sometimes even when you are in crisis, is very important.
Have we any questions from the floor for Philippe? Oh, sorry. Beg your pardon.
Thanks a lot for your presentation.
Will you just wait for the microphone if you don't mind, so our virtual colleagues can hear us?
So thanks a lot for your presentation. It was really fresh, and we enjoyed this kind of feedback. Do you have a way to connect with other hospital managers in France and share your experience, share good practices, or it was totally impossible over the last 20 months? So has there been some peer learning, or the learning was exclusively within the hospital?
No, we have we have national organization, and we try to share, and we have some publication, and we try to share experiences. Yes, of course.
Daniel, I see you're back with us. That's great. I have one question for you. You said in your survey that 80% of managers said that either they fully achieved or overachieved in the leadership competency. And I know the IHF developed some core leadership competencies in a special interest group led by Eric, who's here with us, and Deborah. And I'm just wondering, did you evaluate leadership against some competencies, or was it the self-evaluation was literally, I think I am great?
honestly answer that. So that's really how they see themselves. That really combination, because I don't think it's true. It might be just me, Daniel, being too critical. Yes, I am. But when you think about reality and how fast or how to work on transforming healthcare, at least here in Brazil, when I see peers, leaders, and even myself, I don't necessarily agree with the number of 80% overachieving or overachieving in terms of most of the concepts that I described there. I even made a joke about the driving, and you ask people how good drivers they are, you usually say I'm a good driver, but they don't really know. So what I challenge here is something that we should think with ourselves. If we are self-evaluating ourselves, honestly, if you are really seeing yourself as what as a leader, because if not, then the problem is even bigger than it was.
Okay. Any questions from the floor for Daniel? I should say the leadership competencies are on the IHF website if anyone wants to access them. Okay, I think I'm going to hand over now to my colleague Inga Kari-Nerheim for the second panel discussion regarding mental health.
Thank you.
Welcome everybody. My name is Dr. Neil Fong and I...
in just a second, we'll come to that. I'm very happy to introduce the panel on mental health. The European Association of Hospital Managers has put mental health on the agenda for many years now, and especially when it comes to discussing our experiences with the COVID crisis in our countries, it is important to address mental health. And we will have two speakers here today. I'm allowed to take off my mask. Oh, thank you.
They can hear you.
Oh. I'm very happy to introduce two speakers, one from Australia and one from Spain, who will address some issues that relate to the mental health problems of our staff and of our populations. And our first speaker is Dr. Neil Fong, who joins us on the screen from Australia. He's Chief Executive Officer at Bethesda Healthcare, and he's also President of the Australian College of Health Service Management. So I give now the floor to Dr. Neil Fong, and he will be with us afterwards on the Q&A. Also remind you that you can use the app, as Lucy has told us about. Neil Fong.
Welcome everybody. My name is Dr. Neil Fong and I am from Australia. I'm the President of the Australasian College of Health Service Management, and I'm pleased to be part of this panel discussion today on the visions and the role of hospital managers in a post-COVID world. I am from Australia, which most of you would know is in the southern hemisphere, way down under. It's a very large country. It's actually one of the continents of the world, and you can see some of the size and scale of our country. It may be no surprise to you that we are probably a very safe place to be as well during COVID, because we are so isolated. In fact, I come from the west coast of Australia in a city called Perth, and we are designated as the most isolated capital city in the world. Just again to give you some scale of where we are, with the whole of Europe and the United Kingdom can fit into our continent basically. And so we have many challenges to deal with, and that can be in a normal time, let alone the time of pandemic. Australia's COVID timeline has been very interesting. Since COVID first came into our universe in February, March last year, you can see the timeline where the cases in Australia have gone. In Australia, we immediately went into fairly much a national lockdown in around about March, April last year. And then after that, after testing became available, we had a very low numbers of cases. We thought we were doing pretty well and we were in a fairly safe position, but you can see that what's happened in the second half of this year, from July through 2021 to now, the cases are still starting to go up. And this is of great concern, and we have been in lockdown in our largest city in Sydney in New South Wales, for the past couple of months, and Melbourne, our second largest city in Victoria, has also still in a fairly serious lockdown. So it's kind of been delayed here, and one of the reasons for this is that we were quite slow to get our vaccination program going in Australia, but now it has taken off, but unfortunately still only around about 50% of our population are vaccinated. You can see there that we've had very low number of cases in Australia, so we've been very fortunate in some respects. We are the second lowest number of cases per head of population in the world. New Zealand is lower than us. And if you look at the WHO figures, I don't show them on this slide, but you'll see that some of the European republics in the 200s, we're down to less than one case in terms of a comparison. So we're very fortunate, but doesn't mean that we haven't dealt with many of the same problems that are dealing with the rest of Australia, with the rest of the world. I want to talk very quickly on some of the factors that the mental health aspects of both managing the COVID within our situation with staff, but also with our community. I don't need to actually go into great detail about this, but obviously the concerns with respect to COVID do relate to actually contracting the virus, the fear then of spreading it, and of course the negative effects and impacts that are in our communities, because in the control it did mean restrictions of movement, social distancing, the physical isolation, and loss of employment and social interaction, and of course the big issue, lockdowns when we weren't able to go anywhere, or curfews. The longer term effects also are there in terms of substance abuse increases and post-traumatic stress disorder as well. We noticed that in the mental health, one of the impacts was the change in terms of how we did healthcare, and I won't go into great detail about this, but to give you one statistic, that the number of general practice visits in Australia that were delivered by telehealth during the period and even up to now has increased by around a third. There were adverse impacts on people's mental health. We did see psychological distress, particularly amongst people aged 18 to 45, and a lot of this did relate to closure of schools and social outings and families getting together and so on, and that's no news to anybody. We also saw a proportion of people experiencing severe psychological distress in the period when we started to move into our high numbers. Suicide rates, interestingly, have remained pretty much at the same levels as they were pre-pandemic, and alcohol and drug consumption changes quite dramatically. For healthcare workers, again, the fear and stress and anxiety related to getting COVID, the fear of passing it on, the overload of staff in terms of needing to quarantine, go on furlough, the dealing with the vaccine hesitancy, and of course the workload pressures due to the fact that we were not able to get workers into our country. Our response has been quite rapid. The vaccination was slow to start, as I said, but we continue to spend a lot of money on supporting business and employment, and so it may not seem much, but for us $291 million is a large proportion which is now being funded through debt. So we need to meet the challenges which what today is about. And some of these challenges will be met through innovation. The most obvious one is telehealth and virtual care. As I said to you before, GP visits, but also mental health. Mental health, as you know, is probably the best place to provide telehealth because it actually doesn't require necessary physical touch. We've also been meeting the challenge of our own healthcare workers and their own health and well-being as they live at the coalface of dealing with infected patients and distressed families. The increased direct and support service has been massive in terms of the dollars that it's costed, as well as the increase in communication. So all throughout the world there's been massive communications and obviously training and resilience to try and make sure that people are prepared to deal with the worst. Leadership, what is required, and I want to here just briefly talk about some of the approaches that we've dealt with in Australia. We have a leadership framework in Australia that's called Health Leads. You can see here that in our view, this is what's required to actually deal with the issue of COVID. Health Leads is basically talking about leading yourself, engaging others, achieving outcomes and driving innovation as we shape our systems. And Margie Worrell, in an interesting article in February last year, made some parallels to this, and I want to draw on this as I close. It's really about when you're leading yourself, you need to be reassured, you need to provide a self-belief model that can make sure that the people around you that you're dealing with in your own mental health and well-being are strong and secure. Engaging others means really rallying together. And if there's any word that's been said throughout the globe in this pandemic, it means we need to work together, whether that be in meeting the needs of our patients and their staff, or whether it means just supporting one another. Achieving outcomes, there needs to be inclusive activity. We need to act. We can't just wait and hang around. I'd have to say that in Australia, probably our vaccination program was quite slow to get off the mark. And we need to lead and act with our heart, not just with our head. We need to be innovative in what we do. And so this agility, this idea of being able to adapt and respond, and we've seen this happen so much in our mental health services in particular, as we cope with this pandemic. And lastly, we need to make sure that we are shaping the system through decisiveness, beware of waiting for too much clarity as we deal with the issues that confront us. So that's what I want to leave with you today. In the Australian government, we have this slogan, which is that we're all in this together. And so as we meet this pandemic, both the current challenges and the long-term challenges of COVID-19, we must do it together. I look forward to discussing with you in our panel a bit later on.
Thank you so much to you, Neil, for this inspiring talk, and we will be happy to take your questions on the Q&A app or afterwards in the plenary here. I'm now giving the floor to our next speaker in the mental health panel, Dr. Carlos Moore, who is the medical director of CAT Barcelona Clinics and associate professor at the Universidad Europea, and also a board member at the Spanish Society of Healthcare Executives. After Carlos has spoken, then we will have a short session with questions and answers for the mental health panel before we give the floor over to the whole session and Lucy. Carlos, happy to listen to you.
Thank you very much. Good afternoon, everybody. And for those of you who come to the road, welcome to Barcelona. Thanks very much for the IHF and obviously to the European Association of Hospital Managers for the invitation to join this panel. And by all means, as general thing, to speak about mental health in this aftermath of the COVID-19 pandemic, because scarcely have we been speaking about, well, it's likely to be the next pandemic in our lives. It's already being, to be honest, but probably we haven't been paying too much attention due to the enormous crisis we have been living through the COVID-19, and especially between March and May and in the last year. There are some things, as Philippe was saying initially, in every crisis there's a huge opportunity behind. And I want to begin with a very optimistical message. In terms of mental health and delivering mental health, healthcare assistance, we have been improving in just 1 year, but probably we will have last maybe 10 years, according to the COVID-19 pandemic. And we have been achieving certain goals we needed to achieve anyway. And probably these crises have been amazingly good to prove that we can diagnose, treat, and follow certain patients with severe mental health disorders throughout its lifespan, and only medically, and learning how to increase their functionality and the things. And last but not least, the data we are recovering are essentially supporting this action. So I think probably we're driving in the right track anyway. Okay. So, let's see. Okay. Sorry for that. Okay. It is true that the context we're moving is that this pandemic has been spreading all over the world, so there's something to be learned from almost any single country. We were discussing with Inge one data that probably we don't take into account recently. 2,600 million people were locked at home for almost 2 months in 2020. Never ever in the history of mankind we have been through such a huge, stressing, and a psychological point of view experience. apart from the amazing thoughts about what the local managers, healthcare managers, and the professional workforce had been through. But it is true that that lockdown, full or partial, have really generated a huge controversy according to mental health care due to the health, social, and economical impacts. And it is true that mental health services often fell in the essential category in the developed nations. There's a lot of national, international strategies to pursue that effect, but clinicians were strongly encouraged to work long distance except in emergencies. Basically, we also locked at some point the healthcare, the mental health professionals during the pandemic, okay? It is true that mental health services had been given a kind of preventive public health role in which the principal task at the beginning was to keep patients out of the hospital emergency department and inpatient wards. To my experience, by that time as the CEO of General Hospital in Madrid in March 2000, basically all of the psychiatric inpatient units in general hospitals, they were locked and they were transformed into huge COVID-19 services. I mean, if we had a general hospital made of 408 beds like it was mine, we finally had in just 2 weeks of pandemic a monographic hospital dedicated to COVID of more than 600. And if we talk about the intensive care unit, it was much even worse. So we basically had no acute patient attention for the psychiatric patients during the first time of the pandemic, and everything had to be done online. It is true the transfer to online work during the pandemic became a prerequisite for continued prevention of mental health services. And the main problem about it is that we had to do it in just hours or maybe 1 week. And as you may know, if implementing changes in healthcare in general, generally speaking, is difficult, when we're dealing with mental health and chronic diseases, chronic status, specialties, at least surrounded by some kind of stigma and discrimination, is very much more difficult. And it is true that the importance of health services for physicians and allied health professionals in reducing the mental health burden from COVID-19 has been, and it still is, astonishing. What is the main concern about what is going on with mental health after or during the COVID-19 pandemic? It is true that the long-term effects of the lockdowns are still very unknown. We don't know what will happen in the forthcoming 5 or 6 years, but we are already collecting data. And the main questions that are arising is, okay, how will the pandemic affect patients with pre-existing disorders? OCD, generalized anxiety disorder, health anxiety, agoraphobia, could you imagine for them? How will lockdown affect patients with major depression, PTSD, and psychotic disorders? Will the incidence of psychiatric illness increase as a result of prolonged quarantine? Those were our main concerns 1.5 years ago. Will there be an upsurge in domestic violence and gender violence? Will self-harm behavior and suicide become much more common as a result of the social and economic adversity we've been through and we're still through? Will unemployed patients with schizophrenia and comorbid substance use disorder manage the pandemic without needing hospitalization in a time where we basically didn't have room for them in our hospitals? So the main responses to COVID and mental health care, obviously, like anywhere else, was really a huge exercise of improvisation, right? The main psychiatric monographic hospitals remained opened, at least there was a broad experience in Spain, were deemed as essential with daily perimeters, screening, open entrance, and staff receiving personal protective equipment, and the social distance and proper masking were required. We basically tend to forbid hospital visits by family members, and it is true that many practitioners, up until the 65% of them, operated online. It was basically, as an extent, what it was done in a lot of social resources such as nursing homes as well. We had some practices involving handling of physical materials were absolutely curtailed or discontinued, so our capacity of diagnostic assessment was lower than ever. It is true, as I was mentioning before, that some emergency psychiatric inpatient units for adults were appointed as specialist psychiatric units for COVID-positive patients that needed psychiatric care, and they did not admit any COVID-19 negative patient. And if you imagine just an example, if we take as a brief example what happened in the autonomous community of Madrid, we basically passed in just 2 weeks of having more than 800 acute inpatient units in different hospitals for a population of 6.5 million of just having 72 in just one hospital, because the rest of them, they were devoted to the treatment of COVID-19 internal patients. So you may imagine the impact on that. Of course, we needed to reorganize the units, to deal with appointment delays, to do some early discharges from the units, sometimes even dreadful, to be honest. And it is true that some patients had difficulties getting their long-acting medication in their community because all the nurses were isolated due to their own infections by SARS-CoV-2, or they were difficulties in getting the medications in some pharmacists. Clinicians in different countries had to learn to manage routine kinds of mental health care via internet platforms all of a sudden, sometimes from their own homes. And it is true that a lot of people had already been using telemental health care, so they were quite used to it. But the main concern was, what about all those people with lack of capacity, with mental severe disorders at some point? Will they be able to be treated online for more than a month, 2 months? Because we need to remember something. We were organizing or improvising a system without knowing how long the crisis will last. Okay, so let's take an example of what happened here in Barcelona. I moved to Barcelona in September 2020, 1 year ago, and we were fronting like the second wave of unfortunately, of COVID-19. So if we take the uptown, Ceres and Gervasi district in Barcelona, the community mental health centers have had almost 1,000 more follow-ups this year. They had 25,000 in 2019 as consecutive visits, and in 2020 they reached almost 27,000. Even when in-person appointments stopped in March 2020, when the state of alarm began in Spain on March 14th. Of course, this really suggests that the telephone follow-ups and the video calls and the calls through Skype, Zoom, Teams, or any kind of telematic things, it really have compensated reduction of inpatient contacts. And the General Hospital, on the other hand, displays a 20% reduction of outpatient appointments, basically moving from more than 4,000 to 3,500. As I was mentioning before, it was essential to keep out of the hospital the unnecessary appointments. But this one thing, which was really true for a lot of patients in our psychiatric appointments, they were fearful. They were afraid of going to the hospitals because the word COVID-19 was everywhere. Of course, phone calls were really integrated in COVID-19 in patients. A lot of coordinating meetings that were handing on, and group and individual interventions were done with the health workers and in the hospital. In my hospital in Madrid, what we began to do is mindfulness groups, therapy groups, and relaxation measures with a lot of first frontline workers at 8 a.m. every single morning, at 12 p.m. after finishing the afternoon and evening shift, and before beginning the night shift. And it is true that all in all, as many healthcare workers are saying these days, what we thought it will be like a 100-meter race and sprint has actually turned into a marathon. And this marathon, at least, will last for another year, at least. So we had the priority of delivering a kind of first aid, and to deliver it fast, and to change the system for just maybe a couple of weeks. We thought that in early April, everything will be normal. Obviously, it was not. So obviously, we need to find empirical evidence that help us to put in place these efficient measures of the most vulnerable and people with severe mental disorders they are. In the University Hospital Liaison Psychiatrists, 5 specific programs were closed in Barcelona. The team was reorganized, increasing its numbers by 6 doctors from other resources, trained in the use of IPE to attend the referrals of COVID inpatients. And you can imagine that for consultant and psychiatrists not used to attend this kind of diseases for more than 20 years, it was quite an exercise of resilience and adaptation. Rotational teams of at least 2 people were created to minimize infection risk in this case. And in the rehabilitation unit, with an open care plan, was shut down on March 16th. 14 patients were discharged by March 19th, and another 2 patients were transferred to the convalescence unit in the hospital. And the patients receive a telematic follow-up by the team. So, as a result, and what is the main lesson I think we learned both in the experience of Madrid and Barcelona, we had a radical readaptation of the psychiatric service. And we had a generalized implementation of telemedicine. We did about 9,000 calls in 8 weeks with only 12 professionals devoted to that. We had a dramatical physical shutdown of the resources and the reorganization of the human resources with those professionals who were not off work due to the COVID, because in some places at least 40% of the professionals got infected by coronavirus. They were included in the COVID teams, visiting exclusively COVID patients. Well, additionally, we initiated 2 programs, namely one program to assist the healthcare professional, which was really essential, since patients and relatives affected by the COVID, and another program for homeless people, which were obviously another main of the targets we had. And the organization resulting from it has already been described in Spain and Europe, like Dr. Orango and Dr. Porcudani described in the autumn of 2020. So, concerning our patient units, they work intensively with the groups, and some of the objectives of the rehabilitation in psychiatric patients, such as daily basic self-care, social relationship and activities, cannot be checked, since they really need presential supervision. And obviously, it suggests that by means of telemedicine, some of the objectives can be pursued and it can be used in the future, because it has been effective, keeping patients stable and maintaining social contact amongst them. And we really had something which remain open, the Psychiatry Day Hospital, with a mixed healthcare system, presenting them by phone. So we really managed the crisis in that way. So I would like to point out the basic learning point from the first wave, apart from the already mentioned, the aforementioned developing of the telemedicine. This response will be articulated with the other levels of the healthcare system, including primary care and other resources in the drug dependence assistance network, where the primary care sectors was working more or less properly, mental health was delivered properly, where otherwise it was quite a disaster, to be honest. So I will leave it for now. Of course, I'm more than open to receive any kind of questions or comments for now, and thank you very much for your attention. Thanks.
Thank you, Carlos. We will then take a few questions directly to Neil and to Carlos. We do not have any on the Q&A. Are there any of you here who want to pose a question? Yes? Microphone is... The microphone is coming. That would be good. Thank you.
Thank you all for the presentation. I'm actually going to ask a question that I think realistically may tie the first panel with the second. One of the takeaways from the first panel that I was hearing, particularly from your experience in Champagne, was that, fundamentally there's more to be gained by taking action than by not taking action, right? There's more to be lost by taking no action, I guess is another way of saying that. And so thinking about that in the context of mental health and recognizing the integration of digital health and realistically just leaving another presentation and with an ongoing theme of its ongoing integration, trying to anticipate the exacerbation of the crisis to come as it relates to mental health, what action in your mind should we actively be taking now to prevent not only the crisis from being exacerbated for our patients who really went without care for a prolonged period of time, but also for our workforces and really a society that otherwise had a shared traumatic experience for the last 20 months or so.
And is there one of the speakers specifically that you want to address this?
I could do it if you want to, Inga. Yeah, no problem.
Thank you,
because thank you very much. It's a fantastic question, to be honest. It's one of the key points. I think we're always trying to establish one demand from the mental health service. Like a lot of people is saying something like, this is our moment arriving, and we need more resources, and we need to implement the services and hiring more professionals. By the way, professionals that they're not very easy to be found nowadays, and I think this is obviously the easy and immediate solution, but we need much more than that. According to my own and humble point of view, what you were talking about society is very essential. We need to promote as a key action here in Europe and elsewhere a kind of promoting mental health into society and to prevent developing those diseases. And it goes through 3 key points that I think they're essential: education, education, and education, starting from the primary school, to be honest. And secondly, we're mentioning a very specific task or target we're facing, healthcare professionals. We need to understand something. We physicians, nurses, everywhere, managers, we're more than tired. I mean, we're exhausted physically, emotionally, and we were not prepared for the flu we had. We were not prepared for such a burden of disease, for such an amazing death toll, for the war we were living and witnessing every day. So I think I need to acknowledge that probably, according to the society's point of view, the healthcare professionals, we are considered to be more valuable than before the crisis. I hope it will be. But of course, we need to take care of their emotions, to take care of the caregiver as a whole, right? And of course, Philippe was saying something also which was great. They will forgive you if you do something excessively, but they won't forgive you if you don't take measures as something as prevention. So what could happen if we're facing another pandemic like that in a couple of years? No one will be forgiven if we just did anything. So I think to implement programs in promoting mental health and taking care of our professionals in the hospital is essential. More than that, just, giving them attention when they are demanding stopping working because they are so depressed. We really need to check out and monitoring their mental health as well.
Thank you. Are there any questions for Neil? I do have one question, Neil, if you can hear us. You ended your talk with saying that there is a need for leadership at every level. And I know you've been strongly involved with leadership programs in Asia as well as internationally. And what would you say is the immediate thing we need to do together to train and focus our leadership to address these issues?
Yes, thank you for that question. I'd like to follow up what Carlos was just saying. I think we have way underestimated the stress and strain and psychological impact that our own workforce have borne. And I really believe that our leadership needs to focus on our healthcare workforce and encouraging them, frankly, being positive about whether it be the nurse manager to the nurse or the chief executive to the executive team. We have an exhausted worldwide healthcare workforce, and frankly, many people are dropping out, and it's going to reinforce that issue. It's the #1 issue here in Australia, exacerbated by our migrations that we can't bring people in, but people are dropping out and people are tired. And I think if we're going to be ready for the next crisis and to pick up on what Philippe was saying, use this positively, we have to do a lot more to support them in their everyday life.
Thank you so much. That gives us the opportunity to address some of the joint questions here. And Lucy, back to you.
Yeah, so I hope Daniel's going to join us as well. So I suppose what we've heard very clearly is that making a decision, even if you have to undo it, is better than no decision. That we need to be prepared for the next crisis because it's around the corner. Equally speaking, I think one of the key messages I think that we're probably all aware of, but it's good to actually articulate it, is the health and well-being and mental health of our healthcare workers are a priority. I said it myself previously that I used to always say patients first and staff a very close second. During this pandemic, I think it very much is obviously patient care, patient safety, but I think ourselves and I think the rest of the world now, there's a focus on the value of healthcare workers. So again, we can open up to the floor any general questions you'd like to ask any member of the panel. Yes, Andres.
Hi, my name is Anders Frafjord, and I'm a president of the Norwegian Association of Hospital Managers, and I'm also a CEO at Acute Hospital in Oslo, Norway. This pandemic, 1.5 years, the elderly people, lots of focus on them, and now talking about mental health. I'm very worried about the employees, of course. We have had 40 to 50% turnovers in some of our units. And then my biggest concern is for the youth and the children. What's the next? We see Norway is a quite small country, so we can have a good overview, and we can see what happens to them. And we also see for the very small children now the RS virus is coming, because Norway is having winter a bit faster than you. Then we are having problems with lots of hospitalization from the really small children. And the youth with the mental problems. We are trying to prepare, but it's hard. So my question is, have any one of you tried to prepare for how to handle the youth and the children in this pandemic scenery? Thank you.
Carlos, would you like to take that one?
Yeah, sure. Well, you're very right in saying that, and let me share some data from Spain. We're in a country of 47 million, and we have almost 17.5 million of people under the age of 18. The incidence of depression, anxiety disorders, agoraphobia, and substance use disorders, especially in the adolescents, have multiplied by 2.8 in just 1 year. If we had a 7.8% of the adolescent population in Spain with depressive symptoms, now we are approaching the incredible number of 20%. So it's quite strange, because we scarcely haven't known from that what have been the consequence of the major lockdown of last year. But it's true that they're facing with and struggling with a lot of difficulties. And they are still under the effect of not knowing, especially the younger children. Basically, that they don't know what happens exactly to them, because all of a sudden they pass from a normal life, from the normal routine, playing with the peers, going to the classroom, practicing sport, to be basically locked at home, following online courses for 3 months. And they physically, they were not back in school until the month of September 2020. So it was quite a big shock, right? And I think we haven't spoken too much to them, frankly, about what happened. So I think basically educational talks and making them understand how the menace was and why they were wearing masks, why they are checking out their temperature every single day when they enter the school. I think this is something to be shared with them, because otherwise we will have increasing numbers of agoraphobia. And it's easy to understand. What could you think if you were a 5, 7, or 8-year-old child and you're locked down in your flat without not even a balcony for 3 months? You may think that there's something horrendous happening outside, right? So how can we expect to get them back to normality? And I think this is something we should really be frankly speaking in the classrooms. Otherwise, when the next crisis will come, they will be shocked again, to be honest. So it's a question of preventive measures.
Thank you very much, Carlos.
I'd like to make a comment on that.
Please do, Neil.
Sure.
I think there's a huge challenge that we can throw out for ourselves into the International Hospital Federation to learn from some of the other countries that maybe
That's very good, Neil. Very, very relevant as well. Any other questions from the floor? Yes, Philippe. Yeah.
About what you said, I read in Japan there is a problem with otaku, people that staying at home, and 100,000 people that are staying at home and don't want to go outside. When I hear you, otaku will be in the future not only the problem of Japan, but the problem of all the world?
It's becoming to be a problem, to be honest, because there's a lot of people who are really afraid of getting out home, and they were hyper-connected with everywhere. And there's something we should really make a reflection about, and we were talking about what the role of healthcare workers and healthcare managers will be. But what about the media? Because the way people is informed through the social network, through the internet, through newspapers about the crisis, what was happening, is really creating a major fear of getting outside. So we have been receiving an overwhelming loads of information throughout the latest 12 months. And this is really establishing that there will be more and more cases like the ones we were describing from Japan, indeed. Yeah.
Daniel, can I ask you, you highlighted obviously the issue of workforce as a challenge, and the pandemic has, I suppose, highlighted further the risk of losing more healthcare workers. Is there anything that you're doing in Brazil to address that?
Yeah, before that, I'll just add something to the other things that Paul was saying here. And then I'll answer a straighter question. I see about kids and all the impact it had on kids and of course, adolescents. I see that they are more into digital, they're more into tablets, they're more into video games, they're more into whatever they can do in their homes, and that's of course has a huge impact. But at the same time, on the bright side, and let me be optimistic here, I see that the pandemic taught us, actually I compare with the HIV in the 90s. The legacy, I was born in 82, and the legacy from the 90s was sex education, and how it changed how parents, schools, and even kids themselves and teenagers talk about sex. And that was probably one of the biggest legacies that HIV left for us in the 90s. And I start seeing the same thing with COVID. Of course, I'm older now, but with my daughter and with the people around me, how education, how they understand better about health, about the impact of health, about the importance of vaccination, and their role into the healthcare system and as a citizen. And that's something really hard to teach in 2 years, really pandemic to that. And I know there's a lot of stress about that, just trying to see how the good side brought us in terms of education for our kids. And that's something we're going to be with us for decades. In terms of your question specifically, we'll see. And that's a very good question because in Brazil we have a lot of burden, have the quantity, the quality, and the distribution, as I said. In terms of quantity, we've been doing a lot of things to improve and to develop more leaders, more healthcare professionals over the last 5 to 10 years in terms of universities and new colleges. The problem is that we are not sure about the quality of these professions. And a lot of doctors, they question if those new doctors, or new nurses, or new biologists, or biochemists, if they are going there and provide service, healthcare service, how good they are. So I think we did a good job in terms of quantity, but we are far behind in terms of quality, and a lot of data improve that. So I have a lot of catch-up to do in terms of quality, and again, in terms of distribution. Of course, telemedicine is helping a lot. We see varies a lot. I'll give an example. In the northeast of Brazil, we have half doctor per 1,000 patients. In Brazil, in the capital, we have 4.5 doctors for 1,000 patients or people. So there's still a lot of distribution work to do there.
Okay. Neil, do you want to add anything to that?
No, I think there's a technology space that we weave this all together that Daniel talked about, that is certainly changing the face of healthcare provision that we can rely on. But I think the volume, and we need to train is just as important. I mean, we forget that there's this population declines and the ageing population in most countries now, of course, as well. So we have to think of some different classes of healthcare workers that we probably haven't thought about before either, more generalist in their nature that we need to really focus on. And of course, the value of leadership in healthcare is something we should also reinforce. The need to develop leadership at every level to provide the change and innovation and the encouragement that our healthcare workforce needs.
Thank you. Yes, Eric, you have a question.
Yeah, thank you. It's probably going to be a provocative question for which it's going to be an open-ended answer. But I want to ask you whether you think, and that's to everybody representing the executive, that you have been enough present in the media. Because we have heard the clinicians fighting, on what should be done. We have heard the trade unions asking for increase of salary. We have heard the politicians discussing about more or less beds. And I think that the executive of healthcare organizations have not been really bringing back the debate sometime on the key questions that have not been put on the public place. So shouldn't we raise our profile and be more in the public debate? And haven't we missed some opportunity during this COVID crisis?
Philippe, I have to ask you that one.
Yes, you're right. But we have a problem. Hospital managers have a problem. Nobody knows that we exist. Well,
exactly.
Yeah, yes, but it's very difficult because you are right. It must be the goal. It must be the goal. But the problem when you speak about hospital, first, a lot of people say hospital is only emergency. In France, it's okay. When people say hospital, people think emergency. They don't know there is other specialty. And after they think doctors and sometimes nurses. Hospital manager, what is it? You are doctor. No. So when media and so on ask what are the solutions about crises and so, they usually go to doctors, never to hospital manager. But that's a problem for our profession, and I think really not a problem. You can be in your skill, in your background, if you have doctor, if you are nurses and so on. But when you are hospital manager, it's a different job with a different training and so on. And we have to promote that because yes, it's an important voice to well manage a crisis. I think so, but it's very difficult to do. I think it's a goal.
Thank you, Eric. I'm just going to ask our panelists and my co-chair to sum up in a very short sentence their takeaway message from this session. So, Carlos, if I may start with you.
Sure. Very briefly, even though the psychiatrists, we tend to talk a lot. We need to admit it.
Imagine it would fit in a tweet.
Exactly. Imagine it was a tweet, or surgical tweet, to be honest. Now, first of all, telemedicine and telehealth has been proven it's an essential tool in mental health and elsewhere, and I think it's a question of future. Second, the inner coordination between primary care level and hospital levels are essential to pursue functionality and to pursue a good follow-up of psychiatric patients. And third, prevention, promotion of health, and education are also part of healthcare managing in terms of mental health.
Thank you. Daniel, can I go to you next, please?
Yes, I just want to encourage hospital managers, especially the ones involved in experience projects, to shift a little bit and not only run patient experience, but also healthcare experience projects.
Thank you. Neil.
I'm just going to repeat what I said before. We need to have care for each other as healthcare leaders. Nothing more.
That's a good tweet. Philippe.
Perhaps all in life is dialectic. There is the good side and the bad side. And whatever you live, try to take the best of the situation.
Very good. Inga Carey.
Well, this won't be a tweet, but I do think that health leaders, hospital leaders, need to think differently about themselves and their role. A health a hospital is not a place where you treat illness. It is a place where you take part in creating good health for the whole of society. And before we take that understanding into ourselves, we will not create the necessary change.
Thank you very much. And just a few more reminders. First of all, thank you all for staying. I know it's late in the afternoon. The recording of this session will be available on the event platform in a few hours. We do have the IHF Awards ceremony this evening at 6 o'clock, if you'd like to join us there in the auditorium. And there'll be a short coffee break and the catering will be downstairs. Tomorrow afternoon is at the closing plenary. The Minister of Health of Catalonia and the Director General of the Dubai Health Authority will share some key features of their hospitals and healthcare delivery systems and discuss the importance of international collaboration, which I think we've heard today. So we'd encourage you to join us at that. And I think we might have time just for the very short video to hopefully whet your appetite to join us in Budapest in March next year. If the video could be played, please.
As we're pulling that back up, can I ask one last question?
You can. You can after.
Dear guest, EIHM announced its Hungarian member organization EGVE to host the 29th Congress of the Association. Due to COVID, the date had to be changed, but the previously announced location and program have not changed. As the president of EGVE, I warmly invite and look forward to welcoming you to our Congress in Budapest on behalf of myself and all members of our association.
Budapest wird Gastgeber des 29. Kongresses der Europäischen Vereinigung der Krankenhausmanager sein. Unsere schöne Hauptstadt wartet darauf, dass Sie hier unvergessliche Tage verbringen. Die historischen Sehenswürdigkeiten von Budapest, die blaue Donau, die besonderen Köstlichkeiten der ungarischen Gastronomie mit dem feurigen ungarischen Weine erwarten Sie.
In our cultural programs, you can see artists with a medical degree or a disability, which fits well with the intellectual aspiration of AHAM and also shows high-quality Hungarian rehabilitation care. We are developing a diverse and colorful scientific program that will address several topics, from today's healthcare challenges to hospital environmental issues, technology challenges, and IT developments. We put special emphasis on medical education, so participants can get to know the results of Hungarian medical universities. The mental consequences of COVID-19 epidemic will be discussed by the AHAM Mental Health Subcommittee.
My name is Diana Ruge-Forsatz and I teach at the Department of Environmental Sciences and Policy. And I've been here a faculty member for many years, well over 10 years.
So here, for example, are the first human retinal gene expression pattern recorded for 100,000 different human retinal cells. Each of them, we get a complete gene expression pattern. And then we can plot these gene expression patterns in such a plot. This is a two-dimensional plot where we project thousands of dimensions of this plot, and two dots are closed when the gene expression is closed.
Budapest szeretettel várja Önöket.
Welcome you in Budapest.
Auf Wiedersehen in Budapest.
My colleague Attila Molnar is here. I don't want to talk to him over coffee, but friend, you wanted to ask one last question.
So sorry for interrupting that. A beautiful segue. I'm a chief executive of 2 hospitals in Northern California in the United States. So to that question before, they don't know us until something doesn't go right necessarily. So that is one nuance.
That's true.
It's true. It's true.
That's very true.
But inevitably, my question. One of the things that in response to my last question, you mentioned education, and I think Daniel mentioned education, and with respect to the conversation around sort of the younger generations, I'm curious to get your perspectives on really a question that I'm asking myself, because I have a 4-year-old at home of my own, and that's, to the sentiment around the tweet length response, in one sentence, what do you think the younger generations should really take away from this experience? What should be the thing that they remember about the last 20 months, and really it's going to be multiple years of this, but so that we don't forget the learnings from this experience?
Wow. You mean just one key learning? Because I will have a list of 20 maybe, but I think the key point is that no matter how horrible is the situation, no matter how hard it can be, no matter how huge is the flood of the crisis, that the capacity of working we have had and we have shown the world has been amazing, and that we shall overcome some of the crises. To be honest, I think what really should remain is a positive message, and stopping focusing on what was wrong, on what we did wrongly, and obviously there were quite a list of things we did not correctly, but the main lesson for them is, look, we had a huge problem and we survived, and we have learned a lot about it. I think this is the key point, especially I have a 9-year-old daughter of my own, and this is quite the key message. We only learn when things go really badly for us, and that's probably the key message.
Or their actions have saved lives. There's a tweet.
Yeah.
Okay, on that note, I beg your pardon.
I didn't have a comment. I just had a quick tweet, and I said, I would say science matters.
Very good. Very good.
Absolutely.
Thank you all for being with us and joining in, and I wish you a pleasant evening. Thank you.